I wanted to introduce to you, and I'm really pleased to introduce to you Charlie Jones. He's a clinical psychologist working in medicine in North Bristol NHS Trust. And we also have Bridget Russell with us. She lives in Stirling and is a self-employed coach and organizational consultant, working with people across public and third sectors. Both Charlie and Bridget believe in relational approach to their work, and this is why they are both so drawn to finding and creating more spaces for listening to each other and having more open conversations. They've been working together on Spaces for Listening since May 2020, and I'm really delighted they can be here today with us to give an overview of Spaces for Listening. And we will have about 10 minutes for Q&A after the presentation as well. And I wonder, Barbara, as well, if you could join that Q&A, that would be great as well. So thank you very much. And Charlie and Bridget, it's over to you.
Thanks, Carol. Yeah, it's really great to be here. I really appreciated that mindfulness just there. What was the line? Give yourself permission to achieve nothing. That I've not heard that one before. I really like that one. But it's really lovely to be here and with you all. It's not exactly a presentation. We're just kind of turning up, and we want to talk about Spaces for Listening, and we want to engage with you and hear your questions. And yeah, it's just lovely to be with everyone. So I suppose to the starting point, if I speak for a bit and then Bridget will come in, and then we'll just kind of see where it takes us. But if we imagine for a moment all the conversations that are happening, all the meetings that are happening in healthcare, in hospitals, healthcare settings now around the country, probably thousands of meetings, thousands of conversations. And I suppose I don't think it's too controversial to say that our meetings are rushed. We don't listen to each other very well. We're very task focused. We never really get to hear about the person behind the role when we're meeting with someone. Sometimes our meetings don't feel safe to say our truth, say how things are. And we want to talk about Spaces for Listening as perhaps one way to nudge that a little bit. The background to Spaces for Listening is it's influenced by the work of Andy Bradley, who some people might know with his work on compassion circles, and the work of Nancy Klein and her work on thinking environments, and the idea that the quality of our thinking depends on the way we treat each other while we're thinking. So we're not saying that every meeting should be run like a Spaces for Listening. We're not saying that at all. But it's an experience that we want to present to you. It's an experience of a different kind of space. And I'll talk in detail about what it involves in a second. But the principles involved in Spaces for Listening are rounds. So we meet in a group and we take turns and we go in a round. So everybody has a turn one at a time. Another principle is equality of participation. So the facilitator is as much of a participant as anybody else. It's a kind of non-expert approach. And the other principle is a light structure. And to be honest with you, I mean, when I first came to this, I felt a bit nervy about a structure like this. I kind of thought structure was a bit anti-freedom. But what I found, and I don't know other people's experience, but I found that the structure is what creates the space. The structure is what enables the sense of safety and freedom to be open in the space. So as Carol said, we started offering Spaces for Listening in about May last year, and we intentionally wanted to move away from the language of well-being, self-care, resilience. We don't use those words. We're very aware that there's loads of amazing work out there in that space, and that's great. But we wanted to position Spaces for Listening as a very human, simple, practical, person-to-person activity. And we thought that framing it as listening was the most accessible way to achieve that. So what actually happens in a Spaces for Listening? Well, it's 8 people meeting in a Zoom space, and it lasts about 50 minutes. Bridget and I are on every call, so one of us facilitates and the other goes first, and then there are 6 other people on the call from anywhere in the UK or beyond, and we have 3 listening rounds. And in each listening round, everybody gets 2 minutes to respond to a prompt. It's completely confidential, and people can use their 2 minutes to say as much or as little as they want, and people can pass if they want to. The prompt in the first round is, how are you and what's on your mind? And then everyone gets 2 minutes to respond. And then the second round, the prompt is, have you any reflections or feelings in the light of round 1? Everybody says their 2 minutes. And then in the third round, the prompt is anything to take away from the call and anything that's resonated that you've appreciated. It's super simple. And at the end of the third round, when the 8th person has spoken, that's the end of the call. So there's no going around, introduce yourself, tell us your name and your job. There's none of that. And in a way, it's not really like a conversation because it doesn't go back and forward. You don't have to kind of jump in. It's very structured. And we've run over 95 sessions so far, and over 400 people have taken part from 40-ish organisations have taken it on in some way. And our intention is around connection. So our intention is around connection to self and connection to other. And it's as simple as that, really. So every session's different, but typically what happens is in the first round, people are surprised by the level of openness. In the second round, people often become a bit emotional, and then in the third round, there's this sense of lightness that people have kind of expressed something and they feel lighter as a result. One of the main kind of themes of feedback that I think Bridget's going to expand a bit more on is this idea of listening without fixing. So listening, often the people who come to Spaces for Listening are in positions of leadership or senior in their organisations, often in positions where they're being invited to give solutions, invited to give advice. And Spaces for Listening is an experience that's different from that. It's a space to listen and not fix, not advise. And it also feels really good as well to speak and not receive advice as well. So we've done this with groups of strangers and we've done it with groups of people who know each other. And it seems equally impactful in those different groups. Our intention is that people come to a Space for Listening, and then if they want to, they can go back to their organisation and do something similar. So the only thing is that you need to experience it. There's no training, it's free, there's no resource. It's just, if you come to a Spaces for Listening and you're kind of confident with a group, you can go back to your organisation and run it if you want to. So it's not about any special powers that Bridget or I have. It's about the structure. That's what it's about, this structure. There's something really important about this structure. Everybody gets information in advance before they come along to kind of make an informed decision about whether they want to participate. And we do sometimes get asked, well, what happens if someone gets upset? What do you do? And the reality is people are emotional all the time. And I think our sense is that Spaces for Listening offers a container for that and a safe space for expression. And I suppose our point is that listening to each other is just a human activity that people have done forever and sat around campfires and listened to each other's stories, and we never needed a kind of very heavy governance structure for that. So I think we're very much seeing it in that frame of a listening space. So we continue to offer 3 or 4 of these sessions a week. Anybody can come to one. If anyone wants to experience one, just get in touch. And yeah, it's available, and we love doing it. So Bridget, have you got enough there to kind of respond to or say some more?
Yeah, thanks, Charlie. So I'll perhaps just say a little bit about the different levels in which people have experienced it. So when we invite people to a space that we're facilitating, or they ask to come to one, they can. A lot of people who come to it simply experience it as an individual, but they get a lot from that one session. So I've had people who've said to me it has changed how they. It's changed, made them really think about their practice with their team. If they happen to be a team manager, that they are listening for longer to their team. So it can just be a one-off experience in its own right. But as Charlie said, we do invite people to think about. We're very open to people coming and experiencing it and then wanting to use it in their own team or in their own organizational groups of which they're a part. And I just wanted to share, I guess, a couple of or two or three examples of that just by way of illustration. So the first and one that I'm kind of particularly fond of just because of the nature of the organisation. We had a couple of people join us from Simon Community in Scotland, based in Glasgow, who are a homeless charity. And they were so taken by their personal experience of it that they wanted to implement it straight away in their organisation. And as you can imagine, during the pandemic, this is a group of staff. They haven't stopped working in the way that they normally work because they're out there supporting people who are homeless, and an incredibly stressful and emotional kind of work that they do. And they realise that they spend so much time thinking about the people they work with, that had they given time to themselves and to each other, as Charlie said, to just have that space in which they are able to talk about how they actually are without jumping into to fix. And that's something that we have a blog that we can share the link for after this that explains it better than I am, of the impact that it had on some individuals, of realising that power of simply. Actually, as Charlie said, so everybody gets something from being listened to, but the bit that seems to surprise people more is the power of listening to other people and what that brings to each of us. So in Simon Community, they have similar to us. They offer open sessions, and they've done it sort of across teams across that organisation. Second example is there's a health board in Wales where a colleague, Susie Tarrant, who's a psychologist who'd come to one of our spaces, has taken it on and is spreading it very organically and successfully across the health board. And one of the things that we would say is the very nature of this approach and the ethos behind it is that people need to be able to choose to come to it. This is not something you mandate. So the invitations we do are, as the invitation would suggest, people are choosing whether or not to come. And where it's worked well in organisations like Susie's Health Board is where people have felt able to choose to come to a number of sessions that are run there. And she's building up a group of people that are able to facilitating those sessions with groups across the Health Board, and kind of she's also connecting the people that are facilitating those sessions so that they have some support as well. So as Charlie said, it's not, we don't see it as a specialist role, but inevitably it's helpful if people have a way of, or somewhere that they can talk about, this came up for me in this session. So kind of peer supervision in a sense. And the third example I'd give is of a health board in Scotland, which a number of people from there who were from a whole range of general management, service management kind of roles, clinical management roles, experienced spaces themselves and were so taken by it that they wanted they're spreading it again organically in their organisation. And the reason I'm mentioning them is because they're kind of a sort of best example of keep it simple. Do not put loads of governance around this. Do not take this to formal committees because it will kill it. And they feel very strongly that they're all incredibly busy. They're incredibly stressed in the middle of dealing with the pandemic, and the last thing they need is anything that makes this too formal or sort of checklisty. Actually, it's about it being an experience. They have each had a very compelling experience of the space, and that's what they want to spread amongst other people, and doing it very, as I say, very organically and across all levels of the organisation. So I think those were the main things I wanted to say. That and just lastly, perhaps to say something that is emerging organically also is that we have a kind of community of practice emerging from all of the organisations where there are people that are, like the ones I've mentioned, are choosing to come together as a group to give each other some support and sharing ideas and experiences. And Charlie and I are involved in that, but actually the greatest thing is that they're taking it on and organising it amongst themselves. They don't need us to do that. So anyone who's interested would be welcome to join that too.
That's absolutely fantastic, and thank you both for giving such a helpful overview. What really struck me was apart from talking about the structure, is the sort of the human element of it. And having had an experience of that firsthand myself, I can fully support that level of connection that is being created in that group. And the three things really that are staying with me is what you said about that this is a space for listening, not for fixing. Also, it kind of gets very much behind the job title, and therefore, the human connection, the human element really comes forth because of that. And then thirdly, what you referred to as the power of listening to other people, and there really is something about that's how we reach out, how we connect, how we listen, how we digest what we hear, and also how we slow down. So that's absolutely fantastic, and thank you so much for that overview. What I would like to do is just to open it to the floor now, and if there are any questions coming up, please answer them the best you can. Thank you.
Thanks. So feel free to, if you want to raise your hand and unmute and ask a question, or you can put it in the chat box as well if you don't want to do that. So we'll open it up now. And if you'd like to put your cameras on, feel free as well. Lisa, go ahead. Yeah.
Hello, thank you so much. That was so interesting to listen to. I was just wondering about your thoughts on working within teams of the same, people within the same teams. Would you recommend it's done with a random group of people that just sign up, rather than working with individual teams within, say, a trust organisation?
Charlie, do you want me to say something about that first?
Yeah.
So just to give you an example, there's another health board in Scotland where it had exactly that conversation, and actually what they've done is they've offered a number of spaces that are open to mixed groups. So and then someone coming to that who might want to then use it in their own team has had an experience directly and then can take it back into their team. And there are examples of people using it within a team. The challenge, or the thing to think about, is if a team manager was to introduce it, does everybody then feel they have to do it? And so that would make it hard for it to be a free choice. The conversation I've had with colleagues in that particular health board is, if they do it in that kind of gradual, organic way, then perhaps all members of the team might have experienced a kind of general space for listening, and then feel more able to do it within the team. So that's my take on it. But Charlie, do you?
Yeah, I don't think it's intended for teams, but next week I'm facilitating a space with the other hospital in Bristol. Their whole staff wellbeing team, they approached me to, so that's fine. But I think the most important thing is that people feel that they opt in. And I think even if you've got a team of 6 people, if one person doesn't want to do it, they might feel from a kind of peer, or will I look like the one? So I think I'm a bit wary of whole teams doing it for that reason, but I think it can work. Yeah.
Brilliant. Thank you. Leslie Ann, you have your hand raised.
Yeah, thank you. I can't do anything in the chat box. It tells me I'm not a member of the chat, so I can't put anything in the I'm guessing that was a problem last week. Yeah, I just wanted to kind of endorse this. This is very much something that's done as part of the Leadership Academy. I've done the NIBEVIN, and one of the first things you do on those courses as an action learning set, or as a group, you come together and you kind of just introduce who you are, give some of your background, and it is very, very powerful. And I completely get the emotional bit, because I think people, if they feel safe in the space, do share things which are quite extraordinary and you wouldn't expect to hear from strangers. Certainly that was my takeaway from the NIBEVin. And it does create bonds, which is very powerful. So I think with regard to Lisa's question, I think for teams, if everybody's willing to do it, it could create a very, very different dynamic and a very powerful bond between a team. But I think that is the cautionary note, is that it has got to be absolute explicit trust, because you don't know what people may share. And I think that was what surprised me when I've sort of done this as part of the course. But I think it's a great thing to do, and I think you're absolutely right. We don't listen to one another enough. And what has struck me over the years is the amount of funerals I've been to, and I've learned things about people that I've known that I never knew why they were here, to learn it from them when I could have participated in it. And that has stayed with me. And even sort of now when I'm talking to people, is learning these different things is so powerful, and it gives you a different way of connecting with staff. So one of the things we're doing at the Trust now is we're setting up all sorts of different Facebook groups for people's hobbies. So we've discovered we've got a lot of gardeners, people who really like gardening and allotments and things. So we've got a little Facebook group. It's our own staff, but it gives a different way of people connecting and getting to know each other. It also means I've got some free gardeners now to sort out some of our spaces, which they're keen to do. So I think it's very powerful, just a cautionary note about the trust and the confidentiality.
I mean, if I could just add to that, we, in some of the groups that, well, across all of the groups that we've run, we have people from all different levels of different organisations, and because we don't actually do introductions by role and organisation, that's really very liberating. And what it means is that people meet as human beings first, and then actually, as you say, Leslie, and kind of discover that there is some kind of common themes like the love of nature and trees, and thank God for open spaces during the pandemic, and so on. So yeah.
Thank you. Carol, did you and Barbara want to share what are the potential next steps?
Yeah.
And what's the ask? Is Barbara on the call still?
Barbara be on the call with us? Yeah, absolutely.
Yeah. So if this group wanted to look at it, what would be some of the next steps? Over to you.
Yeah, so one question I wanted to ask, which links up to what you just said, Jeanette, is about, so because we've got health and well-being leads across the southeast here. So if an organisation wanted to pilot this or look into expanding or using it in their organisation, what would be the steps?
Is that a question to us, Carol?
Yes, sorry.
Yeah.
Sorry.
So I think the first step, it's really simple, but I think to just anyone interested, just come along. I mean, last week we presented to or the week before, to the Southeast Maternity Safety Network, and one of the obstetricians there was really interested. She literally came along the next week and is in a position now to take it back to her consultant colleagues. I mean, it's as quick as that. There's no training course. I mean, literally we've got spaces every week. Anyone's welcome to come along and experience it, and then that's all you need to then start thinking locally about, well, where could I start locally? Where would be an open door? You know, nothing wrong with starting by preaching to the converted and then starting to build some momentum from there. I think what Bridget and our sense is that our role here is to, you know, make the experience available, and then it's up to people to know their own local context miles better than we do, and then you can just kind of carry on.
What we can do also, though, once you've experienced it directly yourself, and if you're then thinking about, so how might I start trying this out, if it's helpful at that point to speak to some of the people that I've mentioned who are in other organisations in other parts of the country, we're kind of that's the advantage. That's one of the advantages of working virtually, that we can connect you up with people in Shetland to across to Belfast, down to the south coast, and anywhere in between. So if that's helpful.
It's absolutely amazing, and it's also lovely to hear that you are building the community of practice around this as well. Barbara, if we can turn to you, if you would be able to say something about the pilot in the Southeast, that would be great.
Yes, so we're looking at doing a small pilot targeted at third-year nursing staff. It's in its very initial stages, and actually we've got a meeting tomorrow, I think, with Sarah Khan, who's the head of practice education, and Dr. Mary Malone, who is the director of the Oxford School of Nursing and Midwifery. So that's going to be our initial point. I think one of the key things for them is to actually go on a course so they can get some experience. And our plan is to have a number of people who've already gone on the course to act as facilitators. And we do have a few clinical leads and a few clinicians who are working for NHSE in an operational capacity who have volunteered to be facilitators. So that's our next stage, is to have those conversations, and hopefully we can get something up and running in the very near future.
Fantastic, thank you, Barbara, for the summary.
Can I just come in on that? I mean, I think it's so helpful what Barbara just said there about people potentially coming to experience it. Just going back to the beginning, it was lovely to do the mindfulness that we started off with, and there's a big difference between how we all engage with that versus if you'd presented for 10 minutes about mindfulness but not actually. And I think, you know, we just love the invitation to come here and talk about spaces for listening, but it's nothing like actually experiencing it.
Excellent, thank you. I think Adele has her hand up. Adele, would you like to unmute and come in?
Hi, Jeanette, can you hear me?
Yes.
Oh, brilliant. So you mentioned about a Southeast pilot, Barbara, which is has a particular target group. And then Charlie, you mentioned about just joining a listening space. So I would like a number of my sort of team who have different responsibilities working with different learners in different ways to get an experience of this, to have more people to determine, you know, is this useful to us? How might we use it? What would be the context for how we might want to sort of pilot it? How do we get, you know, can we just do that, or do we have to be part of the pilot, or can we just get in touch with you and join a number of spaces to get our own experience for that to act as a catalyst for us to have a bit of a chat in our organisation about it?
You would just get in touch with me, and I can give you the dates of all the forthcoming spaces for listening that Charlie and I are doing, and then your colleagues can just choose to come on one of those. It's probably good if they come to different ones, just so that they're getting a mixed experience.
And that's fine.
It's as simple as emailing me.
And thank you, Bridget. What we will do on the Friday email, when we send all the roundup, Adele and others, we will send a link to Bridget, because she's now given us permission, and then she will let you know what her spaces are. In terms of the pilot that Barbara mentioned, that's a specific pilot. But again, if anybody has any specific interest after they've experienced it, then we can have those further conversations.
Brilliant, thank you.